know, questions about activity in the brain, and one is about do you see we've had more data on higher dose osimertinib 160 for meningeal carcinomatosis. What do you perceive there to be an incremental benefit of higher dose for brain metastases or in general in the CNS, or is 80 generally a point of diminishing returns?
I think it's mainly a point of diminishing returns, going above the 80. In my practice, if I'm seeing progression in the brain despite osimertinib 80, I typically don't. We always have that conversation, should we dose escalate to 160? But practically speaking, I'm more so reaching out to my local therapy colleagues, my radiation oncologists, things like that, to provide more durable control.
And also, do you see anything as promising in the kind of acquired resistance post osimertinib with CNS activity or protectivity? Again, so this is a situation where we sometimes will give osimertinib with chemo afterwards because we want to cover the brain, and we're always worried that anything other than osimertinib is lowering the bar to.
Yeah. So, there are now next generation inhibitors that are entering the clinic. Back when we used the paradigm of first generation inhibitors followed by third generation inhibitors, the concern for these compound resistance mutations, that is this T790M plus C797S. And so there are agents, for example, Blueprint Medicine has an agent that's trying to overcome those compound mutations. In terms of the CNS penetration, I don't know that agent. I think it's still early, and ultimately we're going to need clinical data to tell us that.